It's very exciting to actually kick off this webinar as we will learn more from Green Info. You'll learn a little bit about the background. But before we get into the weeds and learn a little bit more about what's going on and where we're going, I'll also would love for Evie Hernandez and Professor Yen to also introduce themselves. So I'll pass it over to you, Evie.
Good morning, everyone. Evie Hernandez. I'm Senior Director of Programs with the California Health Collaborative. And with NCPC, we're the community partner. So excited to be a part of this new venture.
Good morning, everyone. It's very exciting to see all the people putting in their names and affiliations in our Q&A section. I'm Irene Yen, Professor of Public Health, UC Merced. I'm the principal investigator of the Nicotine and Cannabis Policy Center. I hope everyone is doing okay or better these days. Thank you.
Okay, and so we have a very busy morning of presentations. So just looking at the agenda, we are just about to hand over to the amazing Stephen Smith, who joins us from the Green Info. And Green Info are an amazing company that specialize in setting up data dashboards and various other informational hubs. I'll leave Stephen to talk more about that and what exactly they're able to provide in terms of their services. But Green Info actually also supported Trent Johnson and the development of CTHAT. So they are extremely influential. And I'm sure many of you have actually had some interaction with Green Info as part of the run-up to this data dashboard development. We've sent out surveys and spoken to one or two of you, or more than that, I believe, to get your initial thoughts and feelings about the data dashboard so that we can actually progress and move this forward. So Stephen will talk a little bit more about Green Info and what they actually found out from the initial surveys for this NCPC data dashboard. And then we move into the main presentation from Trent Johnson, who joins us from the California Tobacco Health Assessment Tool, or CTHAT, which is part of Stanford. So we can talk a lot more about the ways in which we can develop this data dashboard. So we will leave Trent to talk a little bit more, a lot more about that, as well as taking us through a live demonstration of CTHAT. And then we'll open up to the floor to have questions from everybody. So thank you all for joining us. This is going to be extremely beneficial. And a lot of what we're trying to do is about taking on board your questions, your thoughts, and understanding what it is that will really work within the San Joaquin Valley. We're very much about listening to our community members and to our fellow researchers about what we believe or what you believe will work in the most effective way for the data dashboard. So with that, I will hand over to Stephen. Stephen Smith, who is the team manager for Green Info Network, and he can take us through a little bit more background of both Green Info and the data dashboard development.
Great, thanks so much, Alex. Hey, everybody, thanks so much for having me. It's great to be here today. I love getting in touch with the communities that are involved with the tools that we make. A lot of times we're a little bit at arm's length, but when we get to do a project like this, we get to really engage with you, and it's really always satisfying to loop back and connect with everybody. So like Alex said, I'm the team manager here at Green Info. I'm on our web team, so we have sort of two main practices. We have sort of a data and cartography practice, which is sort of a desktop area, and then we've got a web team. We make online dashboards, maps, interactives, all sorts of different things like that. And the CTHAT project, as you mentioned, was part of our projects in the past. If you haven't heard of us, we're a nonprofit based out of Oakland. We have a strong West Coast focus, but we work with nonprofits, academics, and governments across the country, and occasionally internationally. And we really just focus on topics that are in the public good. You know, we are experts in maps. All of you are experts in all sorts of good things that benefit the world, and we like to sort of join up with you and help your vision come to life. So in this case, with tobacco control and cessation, we've been doing analysis, we've been collecting data and building the CTHAT platform. And now we're really excited to engage with you all in the San Joaquin Valley to look at how we could support you in your needs for a data dashboard there. So you can see that we've been around 30 years, And if you go to the next slide, just as a quick screenshot of some of the work we do all sorts of different stuff, all from environmental things to data analysis, democracy, parks, equity, open source or open spaces, public lands, conservation easements, a wide variety of things. And so all that is highlighted there on our website. So for this project, we engaged in a sort of preliminary research phase where we reached out to many of you. We sent out links to surveys to over 300 people, and we got quite a few responses back that helped us sort of formulate the sort of key issues that are relating to the needs for this particular tool and how we can make it be most successful. And so we heard things that are probably pretty familiar to you about needing to expose data and share data about youth smoking and e-cigarettes, where retailers are located. There's all sorts of complex things around the data with those that we heard from you. And so that'll be front of our mind as we go forward building an interactive tool to share all this data. And we also heard people's needs, like what do they want this dashboard to do and to serve and to support education, prevention materials, and public outreach efforts. So we learned, those key findings, plus a whole bunch of other things, which are going to inform us as we continue to be engaged with you all and develop this system. I've kind of, mentioned some of these things, but, a lot of the things that we heard from you about what makes a successful dashboard was really resonated with us. And, they sort of focus, they touch right on the things that we specialize in. So, maps are hard. And so we try to make them as easy as possible. And so we don't want to give you all something to learn in order to use the tool. So making it very user-friendly and focusing on single use cases so that you're really focused and you don't get overwhelmed with how things work. Make things clear, strong language, clear visuals, and putting the methodology front and center so that those of you who like to check our work can go in and look at that and make sure you have faith in what we do. And of course, you all are focused in the local area here. So what is relevant to you all is more important than like what might be globally relevant to folks who focus on this area. And educational focus rather than enforcement. We thought that was a really interesting thing to uncover so we'll keep our eye on that. And trainings and demos, I'm sure if we have a webinar series going, there'll be recordings and demos and outreach to folks who give some support using the tool. So we learned a lot of stuff, and I'm here today to just sort of put a face to the name and to listen to you all talk and to hear anything else that we need to learn before we really dive into the meat of the work.
Wonderful. Thank you so much, Stephen. That's wonderful background information for the reasons that we're actually setting up this data dashboard. And as I mentioned before, one of the main criteria on the main missions for the NCPC 2.0, as we've been calling it, the renewal, is to set up this data dashboard. So it's great to actually listen to the community, listen to everybody, understand what we all need and want from an effective data dashboard. And I think Trent has summarized that quite nicely. And obviously this whole reason that we're doing this webinar is to learn more from you guys as to what we all think will work effectively. And just to let you know that following this webinar and following kind of more of what Trent was talking about, is that we'll look to have a few more closed discussions with smaller groups of you, so we can really interrogate you on a more personal basis to kind of get more feedback from you. So please be on the lookout in the future for emails, mostly likely from me, my barrage of emails requesting you to do things. So apologies from that perspective. You'll hear a lot more from me in the future about setting up these discussions. And I do hope that you'll be able to join us for those discussions, which will be either a webinar or even maybe in person if we can kind of organize groups to come to Merced, or we can actually go to areas within the Central Valley. So be on the lookout for that. So with that, I will then now hand over to Trent Johnson, who is the main speaker for today, and to kind of outline his experiences with developing the CTHAT data dashboard. And he can kind of explain more about how he set things up and what was useful, what was not useful. So we can move into that. So welcome, Trent. And at this point, I'll also hand over the control of the presentation to you.
Thank you so much, Alex, and thank you all for being here. I'm gonna go ahead and share my slides. All right, so I'm super excited to share our tools, CTHAT, with you all today. Walk through our development process, which was very different. I wish we had had this user engagement, the timeline, and all of the budget up front to do it properly. But I hope what we have now is serving users, but we'll walk through what that looks like. So I'm going to talk through visualizing tobacco control information using the California Tobacco Health Assessment Tool, which we call CTHAT. So I've been at Stanford for 13 years, and I think my first month on the job, I was introduced to Green Info Network. So this was before CTHAT was even developed. They were our geographical system technical provider. Amazing people there. I've loved working with them. And CTHAT wasn't in existence when I started. So we'll talk through the history of developing the tool. We'll talk about the funding sources because it hasn't been one funder. It's been a conglomeration of funding sources that have helped CTHAT evolve over the years. I'll show you what CTHAT is, what the data sources are behind it. We'll talk a little bit about who uses CTHAT and how it's used, how I've used it in local policy education with stakeholders and decision makers. And then I'll do a quick walkthrough about how to actually use the tool. And then talk a little bit about how users have helped shape the tool. So CTHAT began out of a tobacco-related disease research program funded project, TRDRP, which is funding the Nicotine and Cannabis Center. And it started out, we created school shapefiles, which were designed to improve the measurement between tobacco retailer locations and schools. Schools, at the time, 10 years ago, in our research, we were representing them as single points. And as we know, school campuses can be much larger than that. And so when local communities went to create buffers or policies restricting tobacco retailers being located near a school, there was no precision way to tell policymakers how many tobacco retailers were actually within 500 or 1,000 feet of schools without shapefiles. So we worked with Green Info to create public school shapefiles for every school in California so that we could do our research better. This was in search of more precise research measurement to improve some of our research findings. Well, at the end of the grant, we had some extra funds and we really wanted to get these shapefiles out there for the community to use them. We thought they would be a great resource. So we published them online as the California School Campus Database and thought that this would be a great tool for tobacco control programs to have as well. So we did an initial investment in CTHAT and created just a very basic tool with tobacco retailers and school locations and those shapefiles with Green Info's assistance. After that, our principal investigator, Dr. Lisa Hendrickson at Stanford, has been convening the annual surveillance of the tobacco retailers under the California Tobacco Retail Evaluation Contract Surveys under several contracts. And we continued to use those funds to build out CTHAT, to add demographic layers so we could look at disparities in where tobacco retailers were located and the people living in those cities and communities. We then used next additional waves of funding to add policy layers so we could see which communities are being covered by tobacco retailer licensing policies, flavor restrictions on the sale of flavored tobacco products, etc. And over time, we were able to add more features as funding continued to flow. Finally, we had an R01 from the National Cancer Institute, which funded the creation of college campus shapefiles in California. And so this enabled us to add colleges, both public and private, to the tool. So as you can see, this has been 9-10 years in the making, 4 or 5 different funding sources. So we didn't have the luxury of convening stakeholders to see what was needed at the time. We've engaged stakeholders through user testing that Green Info kindly does for us. and have been responsive to community feedback, but we didn't get to kind of set things in motion from the onset with a rich community feedback session. All right, so what is CTHAT? CTHAT's goal was to enable the visualization of pre-existing data or existing data. So we've created very little data beyond the campus shapefiles. So that was original to our creation. But everything else, we're pulling in existing data sources and allowing users to visualize them on top of each other or next to each other, and creating really rich stories that you can bring to decision makers or educating your community. The huge value of CTHAT is it lets you go to whatever geography you're interested in. And we know that local data is really important to decision makers and communities, because without local data, it's really hard to understand whether state trends apply to your community or not. So the data that we've brought together in CTHAT include the state licensed tobacco retailers. This is the foundation of a lot of our research at Stanford in our research group. So that was the first thing we added. We then brought together the public schools, and we've done research on college campuses, which has brought those shapefiles into the tool. And then we added local retail policy layers. More recently, we added adult smoking prevalence and some other measures of prevalence, and then population demographics, which are really powerful. So the URL to see that is pictured there. I'm going to continue talking through some of the data sources. So all of these dates are as of right now. We continually refresh and update the tool as data are available. So the foundation of CTHAT is the tobacco retailer locations, which comes from the California Department of Tax and Fee Administration. Those were last updated in November of 2024. We try and refresh these annually as data become available to us. To this, we've added the California School Campus Database. Those are online as well as its own website. Those can be downloaded, but not every local health department or community group has somebody with expertise in GIS. These require special software. So to be able to visualize these and see that is a benefit of CTHAT on its own. So this includes public K-12 schools, which are originally sourced from the California Department of Education. It includes all public and private university and community colleges. And then it also includes parks or California protected areas, which is a data layer that GreenInfo gets for us. What we're still missing is private K-12 schools. We're working on trying to find a funding source for that, along with other youth-sensitive areas like preschools, libraries. Those are kind of on the wish list that we've heard from users that they want, that we haven't had an answer to yet. To that, we rely on the American Community Survey from the US Census Bureau to provide our demographic data. We use 5-year intercensus estimates that we update as data become available. So this includes age categories, race, ethnicity, income, and percent population on SNAP benefits. More recently, we've been adding data from the California Health Interview Survey. These data are available at the county or aggregated county level. So they're not as local as we wish they were because it protects communities with higher smoking prevalence. So at the county level, you can visualize some disparities by county, but it's not as fine-grained as some of our other data sources like the demographic information. So we currently have data from the 2024 survey for adult current cigarette use, vape use, and tobacco use. And then finally, we rely on the PETS, or the Policy Evaluation Tracking System from the California Tobacco Prevention Program, to supply our local policy data. These were last updated in the fall. And we've pulled out 4 key policy domains: tobacco retailer licensing, flavored restrictions, smoke-free multi-unit housing, and then minimum price or pack policies. These are right now, yes, no. Is the policy in existence or is the policy not in existence? Even though there are various strengths of these policies, we understand that. But it's really difficult to add really sophisticated manipulations to the layers for all users to be able to use efficiently. And I'm sure that's going to be a discussion down the road. How detailed can you get when you're serving lots of people with one data dashboard? So another huge benefit of CTHAT is that you can choose your geography. So we have individual school neighborhoods that you can create statistics or information about. You can actually type in, here we have Montezuma Elementary School. You can actually draw, using CTHAT, a half-mile buffer around that specific elementary school and see how many tobacco retailers are there, and look at the number of retailers within a 500 or 1,000 foot buffer of the school shapefile. We can also create descriptive statistics or information about who lives there, income, race, ethnicity, and tobacco retailers for individual cities, the counties, or county unincorporated areas. And that county unincorporated area is a really difficult thing, both conceptually, but also when people go in to count the people living in the unincorporated areas using the census, it's a very high task, and Green Info has built all of that into the tool for us. So that's a huge asset. So who uses CTHAT and for what? So this is based on conversations we've had and user polls of CTHAT users. Public health departments have used CTHAT to educate policymakers or to do needs assessments, identifying areas with particularly high concentrations of tobacco retailers or tobacco retailers that are located near youth-sensitive areas like schools or parks, and educating them in the name of policy change. Oh, policymakers down here can use it to visualize potential policy impacts and disparities. And then finally, community partners and coalitions. So I serve on my local coalition, the San Luis Obispo County Tobacco Control Coalition, and I've met with policymakers from several municipalities here. And what I will do is I'll print out a CTHAT report, and I'll identify on that report which retailers are near parks or near schools, where students can easily walk from that school during lunchtime and be exposed to tobacco marketing and access tobacco products. I'm going to talk through a few other case studies where CTHAT has been used. Here's a couple news articles from West Menlo Park and the Palo Alto Daily. And this was actually the PI of CTHAT, Lisa Hendrickson, noticed a smoke shop was about to pop up down the road from where she lived. And she brought it to the attention of the supervisor of the county unincorporated area. And she used CTHAT to demonstrate that the shop was near youth-sensitive areas and that it was already within 500 feet of an existing tobacco retailer. So these are some quotes that were pulled out by the newspapers. The shop would have been within 300 feet of the University Heights Montessori Children's Center preschool and within 1,000 feet of the Phillips Brooks School and the Law Entrada Middle School field. So these are the types of things that we hope CTHAT can be used for, among other things. A couple other use cases in Shasta County, they used a statistic from CTHAT. According to the California Health Assessment Tool, just over 54% of Redding public schools are within 1,000 feet of a tobacco retailer. And then finally, this article titled "Urged On by LGBTQ+ Activists, California Cities Weigh Stricter Smoking Rules." And this is a story out of Vallejo where they reported a CTHAT stat about almost 31% of public schools in Vallejo are within 1,000 feet of a tobacco retailer. I see a couple other questions. I'm going to get to those during my transition to the live demo of CTHAT. And then the city of Grover Beach is another one. I met with the mayor and I printed out the CTHAT fact sheets. This descriptive report on the left shows us how many tobacco retailers are in the city, the retailers per population, which is a measure of tobacco retailer density. And that varies widely across the state, from upwards of 5 tobacco retailers per 1,000 population. And then it gets rather low in other jurisdictions. So these can be really powerful when talking to decision makers or community groups to help them understand how tobacco retailers may be an issue in their community. All right, with that, I'm going to actually turn over to CTHAT itself and walk through how to use the tool. And then I might point out a few features that users have helped improve or guided us along the way. Let me turn to the Q&A really quickly. All right, so Colleen has some ideas for additional layers. So I'm going to jot those down in my notes. A question about the California Health Interview Survey. Let me come back to that one, perhaps if we have time later. And then policies for the distance required between new tobacco retailers and schools. Yes, that one is actually a policy that exists in a handful of communities throughout California, a policy that would restrict another tobacco retailer from locating near an existing tobacco retailer. There's policies that are 500 feet, 1,000 feet, where to prohibit new retailers from opening in the name of decreasing tobacco retailer density. And if you send me an email, I can share what jurisdictions have those policies. Those data are also available on CTHAT. Sorry, not CTHAT, but PETS, the policy evaluation tool from California Tobacco Control Program. Okay, I'm going to switch over to CTHAT. Alex, can you give me a thumbs up if you can see the CTHAT website? Okay, thank you so much. So this is the landing page for CTHAT. And by default, the tobacco retailers are turned on. Those are the red dots. Down here in the right-hand side is the legend that will automatically update as we add layers. So we've undergone user testing, and the website has changed throughout its 10-year history. I'll try and highlight some of those changes as we go through this. On the left-hand side is a data pane with some statistics about the geography that we currently have selected. So right now you can see that California is the geography of interest. And across the state, we have approximately 29,228 tobacco retailers. 3,162 retailers are within 500 feet of a school. And then so on. We have information about the number of schools, the number of people living in a jurisdiction, age, race, ethnicity, earnings, and poverty. Now, one thing that users have already pointed out to us is that these statistics on the left are not self-explanatory. We don't understand necessarily if these are counts of people or of retailers, right? And I'm far too close to this tool, and I've been working with it for years. So on our next update, we will be enhancing the usability of the tool, some labeling and other features. But that's just one example of where users and people who engage with this tool have been really valuable about helping us understand the UI aspect and how we can make it better and more accessible. So all of this on the left-hand side is for the state as a whole, but I can also type in an individual geography. So let's start with Fresno. And here we have auto-populating every jurisdiction in the state. So I'm going to select Fresno. And not only did the map on the right-hand side zoom to Fresno and outlined it in black, but it also updated all of the statistics on the left-hand side with specific information about Fresno. So there's 557 tobacco retailers in Fresno, and then it recomputes the density characteristics, the number of retailers near schools, and so on. All of this information is available in the US Census, but this is also a really quick way to quickly get how many people live in Fresno, right? And so the population is 543,000. And I can see that that's from the American Community Survey, the 2019 to 2023 intercensal estimates. So that's how we navigate, how we choose our geography. We can also look at unincorporated areas or the county as a whole. So here, if I go down to unincorporated Fresno County, I can see the geography that is not incorporated areas, but the unincorporated areas, and get all of the same reporting statistics on the left-hand side. Okay, let's move to the city of Visalia and add some layers. So here's Visalia. They have 99 tobacco retailers. And we can zoom in and see where those retailers are located. I've talked a lot about schools. So let's go ahead and add the school points. These little gold dots represent the school locations. And prior to creating the campus boundaries, this is all we could get. We could get the school points, but we know schools are much larger than a single point on a map. So we're able to draw these extensions of school boundaries, and they default to 500 or 1,000 feet. These are really common restrictions or policy restrictions throughout the state. We're hoping that those will gradually increase, and we hope to be able to add a feature with larger buffers so that local jurisdictions can be a bit more ambitious about their policy goals. I'm also going to turn on university or campus layers, so when we encounter those, we'll be able to see them. So now we can see tobacco retailers within a 500-foot, this darker gold, or 1,000 feet of a school. So what this can show you is perhaps number of retailers that would be affected by a policy in Visalia that restricted retailers being located near schools. So in this scenario, there are 8 tobacco retailers within 500 feet of a school, or 25 within 1,000 feet. What we can also do is add layers about demographics. So let's say we were interested in school-age children, ages 5 to 17. We can add that layer to see if perhaps retailers are disproportionately locating in neighborhoods with more young people. And what this defaults to is statewide quartiles. So a quartile is 4 equal divisions of the range of available data across the state, right? So that may not be as useful if we're looking at a city. So we actually have the option of quartiling by county. So the statewide would let Visalia be also compared to really dense urban areas like San Francisco or Los Angeles. But if we use the county quartiles, then we're just creating those 4 equal divisions based on the range of values within the county itself. So this gives us a little more localized view of how demographics might be distributed within Visalia. So looking at the legend in the right, the lightest color is the fewest number of young people, ages 5 to 17, and the darker squares are the highest concentration of young people. Sorry about the jumpy map here. So here we can see in these dark squares, there's actually a really high proportion of young people living in those squares. The highest quartile, with over 26.7% of young people, are in this darkest shade of gray. So those might be something that you might want to call out to community groups or policy makers that these are really problematic concentrations of tobacco retailers that might be something worth addressing. Let's say you wanted to take this map and export it into something usable. There's a few ways to do that. Over here on the right-hand side, there are this export, and this share link allows you to send this exact view or this snapshot since we've selected multiple features and multiple data layers. And you can send this link to somebody, send it to a colleague or a decision maker. You can also select this PDF icon. And what that will do is allow you to drag and select a geography and create a printable PDF that you can download and embed into a PowerPoint presentation or email off to a colleague. Click there to download. And this is what that looks like. So what it does is it makes a really nice map with the legend that's kind of zoomed in on so you can easily read that and embed it however you want. The other cool thing is the PDF report. And that's what I said that I've used with my policymakers here. And what this will do is create a similar thing, but it takes the dashboard on the left-hand side, all of the descriptive statistics, and it puts those on the first page. And then it creates a nice map of the entire city along with the legend on the right-hand side. Now, you might say all of this is a lot, right? How many buttons did Trent click on to create this and to export it? And these are the things that users can help inform. Even my colleagues at Stanford, I have to remind them, how do you do these things? So I see user guides and trainings and tutorials as vital to accompany a dashboard like this, so that users can interact with it and use it, because it can be overwhelming at first. We have this how-to button in the bottom right, which does have a basic how to create a map. This is a guide step-by-step how to create a map. But even then, there are so many features embedded in CTHAT that sometimes they can be hard to uncover. So what I'm going to do is I'm going to clear results from this map. And it's going to take me back to the state as a whole. And then I'm going to turn off some of these layers so that we can look at some policy layers. Okay, so let's look at the state as a whole. All right, so a couple other things that I talked about we have in CTHAT are the policy layers. So I'm going to go to local policies. And I'm going to click on the information box just so we can see what we're dealing with. So these come from the PETS data system, and these are policy data as of October 2024. Important to know, how old are these policies that we're trying to visualize here? So here is tobacco retailer licensing. So I saw that come up in the chat as a geography in need of these, but you can see that there are a lot of geographies, especially in more rural areas, the Central Valley, that do not have a tobacco retailer policy, tobacco retailer licensing policy. And that's just the basic requirement that every retailer in that jurisdiction is monitored by the local jurisdiction and applies for a relatively low-cost license to sell tobacco products at the local level. We can also look at flavor sales restrictions, which, even though we now have a statewide restriction on the sale of flavored products, sometimes adding a local policy provision enhances the capability for the local health department to support policy enforcement and monitoring. So you can see that the coastal areas, again, have more flavor sales restrictions. Smoke-free multi-unit housing has been gaining traction recently. We can see that even areas on the Central Coast are absent of these policies, but they have been progressing over time as the Bay Area and parts of LA County begin to fill these in. Moving on from local policies, let's just look at the tobacco use layers. I mentioned earlier that these are at the county level, so they don't allow you to paint a very local picture of what's going on in your city. But at least there are some trends here that you can pick out. So here we can see that there seems to be higher rates of cigarette use in the northern part of our state, perhaps the lower Central Valley, and along the coast, there does seem to be decreased rates of current cigarette use. Vaping use seems to have a slightly different trend, and then current tobacco product use, and then finally current flavored tobacco product use. So these are all things that you can visualize in conjunction with tobacco retailers and schools. So I leave it to you all to figure out what your community, what story you want to tell in your community, right? Because it's going to be different city by city, jurisdiction by jurisdiction. What is important? What is your population in need of support on? So I leave that to you to figure out what map works for you all. So see that, please try it out. And you can always email me to recommend features or ask questions along the way.
Wonderful. Well, thank you so much, Trent. This is absolutely fantastic. And I know that there are a number of questions we have from the audience, but we'll get to those in a moment. So thank you for putting those questions in there. But at this moment in time, I'll hand over to Dr. Durazo and Dr. Yen, who I believe have a few questions for Trent that I think will delve deeper into in what we're trying to do with our own data dashboard. So at this point, I'll hand over to Dr. Durazo, who can provide a few more questions for you, Trent.
Sure. But before we even jump in, I do want to acknowledge Trent. You'll see that in the Q&A, there's already a lot of great comments about even with your demonstration about Fresno and the retail licensing. So thank you everybody for a lot of your great comments and your of supporting how useful and valuable this data is. So yes. So but why don't we start with the actual questions that are open, because I know, like, for example, Colleen Naughton had already brought up a couple of things that were really, high level. So one of them, because I'm actually curious about this myself, Colleen Naughton had asked, who's a professor here at UC Merced, and does a lot of the wastewater epidemiology, and is actually one of our inaugural pilot grantees to look at the presence of nicotine in our wastewater. So really exciting to have you here. The question is there a way to separate out unincorporated cities then all grouped under county?
Unincorporated cities, yes. So the unincorporated layer is all of the it is the jurisdiction that is as far as policies go, controlled by the county policy decisions at the unincorporated areas. So those, let's just look at a more dense area. So San Jose, let's see, no, that's Santa Clara County. So unincorporated Santa Clara County, right? It is this dark line and it cuts out the city of Gilroy, which is the incorporated city of Gilroy. So I think that's what you're going for, but yes, this is the aggregation of all of the unincorporated geography, and it cuts out incorporated cities. Does that answer your question? Please let me know if not.
Hi, Colleen, any follow-up question or comment on that before I move to the next person? Okay, thank you. And then, and once again, anybody just, if you click on the Q and with the little actual and symbol and a, you could type in any questions and we'll go ahead and get through those. And then someone just made, added a comment that it would be awesome if there could be city, district, and county supervisor district boundary layer.
Thank you. That is actually on the wish list that will probably be addressed later this year. So political boundaries, decision-making boundaries, we are trying to find as many of those that are publicly existing online. We plan to create a layer for that, but this is where we're actually going to ask users to submit any GIS layers that they have. So we'll kind of put the foundation on working with Green Info, but then we're going to rely on users to submit those GIS layers as they come across them, if they want them to be available in their communities.
Thank you, Trent. So Trent, and you touched on it slightly at the beginning, and you could definitely bridge on that about, like if you could turn back time, if you were able to, if you were to build CTHAT again, and it's really wonderful that you're one of the actual, original architects of this data dashboard, what would you and your team do differently?
Yeah, so working with prospective users of the tool would have been incredibly valuable. I wouldn't say we've had to backtrack, but we would have made different priorities along the way, right? Like our priority was, it was a offshoot of our research. So we started with the school boundary shapefiles, and then we slowly added things piecemeal along the way. Fortunately, nothing was something that users weren't using. But we would have ranked and prioritized things based on user requests. So for example, the political decision-making boundaries, that's been one that's come up frequently. And it's not one we would have thought of as researchers, right? But you out in the field, that is something that's really important to you all because you're working with individual decision makers responsible for a subset, even a subset of a city. So that would be really valuable to you all. And that would have been something that we maybe would have built in from the onset. So engaging with prospective users and ranking and prioritizing feature build out would have been something that I would have loved that we could have done.
This is Irene. I'm jumping in with a question for you. Thank you so much. Really wonderful presentation. I'm actually calling an audible because you answered one of the questions that I was planning to ask. And you've mentioned that you have a wish list of adding things in and clearly thinking ahead to how you're going to do that. And you also mentioned that there's been multiple funding sources over the years. So I'm curious if you can say roughly for a new layer to be added on, although I don't know that you would approach the work this way, but what roughly is the cost to do something like that? So to be able to say, put in those political boundaries, if you didn't actually have a plan to do it, how much does it roughly cost to add in another layering?
Yeah, well, Stephen may know better than I, but I think there's a huge range in cost of layers, right? Based on the complexity of them and whether there are additional statistics tied to those layers, right? So like the tobacco retailers, Green Info will calculate the distance from every tobacco retailer to every school. And they do that offline so that when I use the map, it's pulling from a known set of information and it doesn't have to recompute it on the fly, right? Something like the policy layers are available for the jurisdictions. So there's 542 possible jurisdictions there. So that you're working with not too many shape files that you're having to shade and create the data for. Stephen, do you have more insight into kind of, we want to add a new layer, what the range of costs might be?
That's a great question. I'm looking back at some of the notes to get a little bit more of a specific answer. But yeah, Trent's right. Bringing a layer into the map just so you could visually see it in relation to other things is a very low cost, on the orders, let's just say less than $1,000, just to pick a number. And then if there's analysis involved, if there's data cleanup, if we have to do research, if we have to compile data sets, I'll double check things and see if I can find a different number in our notes here, but I'm thinking in like the 5 to 10K range, depending on how complex it is. So that's like a safe buffer to say for new data sets in the future.
Thank you.
Thank you so much. Okay, so I see more questions coming in the Q&A. I'd like to now move to Guilherme Samperlin Redondos. Well, first I want to introduce him because he's an incoming PhD student who's going to be part of NCPC. So welcome, Guilherme. It's wonderful to have you here. And actually, Guilherme has been having some really terrific ideas on how to look at how tobacco retail licensing, all the impacts and how it looks like across our region based on when there's licensing at the city level versus the state level, but way down the line. So Guilherme, wonderful to have you here. And so Guilherme asks, would it be possible to implement a classification of retailers, such as gas stations, smoke shops, and convenience stores within the dashboard?
I would love that. That's something that we know as researchers that store type determines so many things about what a tobacco retailer sells and some of the negative behaviors that might occur at that retailer. Unfortunately, there's really poor information that's available about store type unless we send people into every single store across the state to classify it, right? So the California CTHAT licensing list does have a NAICS code or a North American classification, industrial classification code. but we found that it's not very reliable. You will go to convenience stores that have a smoke shop NAICS code, or smoke shops are classified as alcohol retailers. So unfortunately, with 29,000 retailers, there's no good data source, and we really don't want to put bad data on CTHAT, because you know your communities better than us, and you're going to go on CTHAT and be like, that's not a smoke shop. Why did they say that was a smoke shop, right? You're going to say, oh, it's just a regular bodega corner store. So we really want to try and avoid those discrepancies. And even using the state licensing list, people come to us all the time and say, there's no retailer there anymore. That retailer closed down last year. And that just happens because somebody will renew the license, like say CVS, they stop selling, but they remain on the licensing list for a year or more, right? Those sort of data discrepancies happen all the time. So we try and avoid them so that we do the best we can using the best available data.
Thank you, Trent. Also, next, we have Dr. Denise Bayan at UC Irvine, who is also a collaborator. And thank you so much for joining us on the actual NCPC renewal, Dr. Bayan. So Dr. Bayan shares the following. And I want to add, actually, Dr. Bayan is on a very related topic as we develop this and we grow in our next phase of the Nicotine Cannabis Policy Center. Dr. Bayan is going to be leading on how do we measure the impact of existing tobacco, related policy. So, please be on the lookout for webinars later this year and next year on exactly this topic. So, Dr. Bayan says, see that is an extremely helpful tool. Thank you. I see Delano is covered by a local flavored tobacco sales restriction in the map, but they repealed their flavored tobacco sales restriction a few years ago after Senate Bill 793 was adopted. I know the source is pets, and I also actually echo on this one. I'm with you. Can you speak about the challenges with changing policy environments and tracking?
Yeah, that's a tricky one, right? We often will catalog the passage of policies, but when they get repealed, that often fails to make it into either PETS or even some of those other national groups like the Truth Initiative or CTFK, who are tracking those local policies. PETS they're kind of on a data collection pause, and I think they're going to release new coding and new data at the 1st of 2026. When I discover discrepancies in any of those 3 data sources I mentioned, PETS, CTFK, or Truth, who are all tracking flavor policies in California in various ways, I try and alert the authors of those to these discrepancies. So I would say that anytime I'm going to make a note about Delano, but if you pass those on, we all want to create better data sources. So that's valuable information that you can help these data collection people improve. And it affects our research too, because we are trying to evaluate the impact of these policies. And if we don't have accurate policy information, then our findings will be muddled, or we won't find a relationship and that sort of thing. So yeah, I think just try and, we all are a community of tobacco control. We should try and get this information out there as much as possible and try and help each other out when possible.
Thank you. I'm going to move to Katie Johnson. Welcome, Katie Johnson. Katie, thank you for all the great work you do here in the region. Katie's comment is CTPP requires all the LLAs, the local leading agencies, to go into their local retailers as part of the data that we collect. As part of the data we collect is store type. So this data does exist. I think it would be really useful to connect CTHAT with the California Tobacco Evaluation Center at UC Davis, where that data is centralized.
Yes. So all of the locals are collecting, they're visiting every retailer in the state as part of their work plans, I guess would be my question to Katie.
Katie, any follow-up? I'm looking at the Q&A feed right now. If you want to follow up to that. Oh, where did it go? There you go. Hi.
Yeah, so that's something we can ask CTPP about, whether that's being done in a way that we would be comfortable using that data. And it could be something like it could be like a beta layer where perhaps it's available under certain understanding that this data was collected by different entities, right? Because not all data collections are the same. So there'd be a lot of questions there, but it's something that I can certainly bring up with CTPP and ask them how they would feel about that.
Thank you.
Thank
Trent,
you.
I'm going to switch gears a little because we do want to check, as we're thinking of embarking in this new data dashboard and, we have this opportunity to hear from you. And actually, this might relate to both you, Trent, and Stephen. So as we envision, as we're embarking, what are our priorities? What's going to meet our needs for this data dashboard that's based in the San Joaquin Valley? And that's different from what exists, especially such as PETS or CTHAT. Tell us about your experiences, how to best prepare to get to the point where we're beta testing. Like what are your pearls of wisdom on how to prepare as a significant collaborative with, which we borrowed kind of like this hub and spoke model. We're growing together along with each other. So what can you say about the data dashboard development, steps, and this is like one of the biggest first steps, and then how do we prepare and envision the beta testing?
Stephen, do you want me to go first with what we did, and then you can go with the proper way to do it?
Yeah, let's hear about what you did while I come up with an answer myself.
Okay. So given our conglomeration of funding sources, we were just fortunate enough to get something out there to begin with. So we got the first iteration out and we tested it internally, but we didn't have funding to do anything more than that. So we made sure it worked, that it served our purposes, and we hoped people would use it and be able to use it. I provided technical assistance along the way, and I continue to do that, and I'm glad to. As more funding came through, we built in user testing, but we still had a vision and a scope of work that we were fulfilling for the data dashboard itself. So we would do intensive interviews with 5 to 10 users, incorporate their feedback, and refine the tool to make it more user-friendly. But beyond that, we didn't have the opportunity to do kind of from the ground beta testing and huge revisions, right? Because it's an existing product and we can only change it in so many ways.
All right. That's definitely one way that we do it, and that works really well. And there's definitely no one right way or best way, but I could rattle off sort of a high level sort of prototypical approach that I might imagine here. So really the most important thing is that feedback loop, right? And by starting with community outreach and getting their input, we are really starting with a rich well of needs and desires to work from. And so when it comes to now the building phase, it's taking that feedback, taking the data sets that they were interested in, and seeing, sort of in parallel, where can we find the data and what can we do with it? And then with this feedback and with making web applications, how can we make a easy to use, accessible, and functional tool for the dashboard? And so sort of looking at those two things together, the data can only do so much. And like Trent was saying, when you just had school centroids versus the parcels, right? It's a lot different. So what can those things do? Bring them together into a design phase. And so we use Figma as a prototyping platform. And drawing a picture of a website is a lot faster than actually writing it and drawing it, or I'm sorry, designing the code for it. And so that allows for a really quick back and forth between us and the client on what here's a vision, here's your feedback, here's the revision, here's your feedback. And then the next step, which it sounds like is going to be part of this, will be the community outreach again. So if we kind of get to the place where, like, based on the feedback, based on the data, based on the functionality we envision, this is what this tool might look like, and these are the ways it might work. When we then go out into the community, test it with folks, get their input, and continue the revisions from there. So as much time as there is for revisions is as many times as we could improve the tool. But definitely getting it out there, launching it, getting that feedback, and revising it is sort of the crux of it.
Thank you so much, Trent and Stephen, for that. Actually, you're having this exchange and listening to you. Evie, this reminds me, I think it was a year ago, Evie, this is something you told us to do, and you've had your share of experiences of being on the ground up with a lot of the, tobacco related data dashboards that currently exist in California. So I remember you, telling us, like, you must do this. And I'm so grateful. And this is what's actually inspired that we've done all this work, like doing the community survey that Green Info led, and then also, kicking the actual steps for design and future implementation with this webinar. So I'm going to pass it over to Irene Yen. But before I go there is a follow-up question I do have, and it's actually tied to something you brought up, Colleen. Where is it that? Where did I see that? Oh, no, okay. The one about the funding. So, okay, general question. I believe that you were funded by TRDRP, years ago when you first initiated this. So just overall, in thinking about how to, the sustainability of the data dashboard, in thinking about, enhancements, expanding, we'd love to hear about how you've been able to kind of keep the funding and the maintenance and the sustainability of CTHAT?
Yeah, good question. So we have been fortunate enough to align the kind of the underlying goal of CTHAT with several funding sources. And if funding were to dry up for CTHAT, we wouldn't be able to make updates, right? Green Info does host it, so our hope is that if there was a gap in funding, perhaps Green Info would keep it live, keep it running for as long as they're comfortable doing. But we wouldn't be able to curate the data and push that out to them to make updates. But yeah, I think building it in to multiple projects does make it a bit more sustainable, because if one or two projects aren't able to go through, perhaps that third one is able to fund updates and maintenance of the CTHAT website.
I'll pass it over to you, Irene.
Oh, okay, thanks. I wanted to just raise up a couple of questions from the Q&A. One of the people asked about if you can do 500 feet buffers around other retailers. I think it got moved over. And so could you calculate distances from retailers to retailers?
Yes, so I was trying to go through my history of requests for CTHAT. We had investigated that, but I believe it was under the guise of a policy simulator, where we would apply a policy to a jurisdiction and you would see what the effect was. So if you were to apply a retailer buffer restriction, which retailers would be affected? We were a bit concerned about what the takeaways were if a business were to plug in a policy and they saw that their specific location would be under threat, what that might do to their motivation to kind of advocate against this type of work. But as a pure identification of retailers within a certain perimeter of another retailer, I think that is a great idea. And I've actually added that to our list of possible features.
And I think you were actually responding to the other question I was pulling out of the chat.
Okay.
What would be considered a high density of tobacco retailers?
Yeah. So in a city, thank you for the question. I think it varies, right? Because if you're in the city of Los Angeles, like that's a very different city than the city of Sacramento or one of the suburbs of Sacramento. So I really think this is a very localized question. You should visit some of the neighboring jurisdictions and see what the retailer densities look like in those jurisdictions. Because there's such a huge range. There are some cities that only have 10 people in them, but they might have 2 retailers. And that doesn't sound like a lot of retailers, but when you look at the density, it completely skews things just because it's a very small area and not many people actually live there.
Thank you. I'm just checking to see if I think the other thing was the Cal and Viro screen layers got mentioned.
Yeah, I saw that. That is a cool recommendation. I'll look into that. The other idea I heard, and I actually stumbled upon this reading a research article, was that idea that you can actually detect nicotine and or cannabis in wastewater. And that would also be another cool possible layer. But I'm going to keep this one in my notes as well.
So Colleen Naughton, who's raised a number of these questions, is doing a wastewater study looking at nicotine. That's the plan for this coming year in a couple of areas.
Okay, that is so cool.
Yeah. Okay, thanks so much. I think I'm done with this piece of the Q&A.
Thank you. Evie, are there any questions or comments that you'd like to bring up?
Yes, I really wanted to ask Trent, what does your team look like? And what are some of the experiences or skills that they bring to the team so that we can consider that as we move ahead with the dashboard?
Yeah, thank you. So we have the principal investigator on our team, Professor Lisa Hendrickson. She's been in tobacco control research for 25 plus years. And alongside her is a PhD level statistician who also has the same number of years in experience. And I think being really critical about the data sources is really valuable, because when we get questions about tobacco retailer locations, like we're using the best data possible, but there are countless other data sources that we've not put on CTHAT because we know there would be even more discrepancies or more issues with it. So not only is she critical of the data sources to make sure we're only using very high quality data, but an immense amount of data cleaning goes on behind the scenes to refine all of the addresses and the layers and the locations of everything to make it as clean and accurate as possible. I manage all of the day-to-day project budgets and timelines, so I'm more of the like liaising with Green Info and supporting the user testing piece of it. And then we have other staff as well that help us brainstorm and review the website. So it's those are kind of the cornerstones of our team.
Thank you so much. So I'm going to go ahead and wrap up the Q&A so we could, because I did have a question, but it's actually related to the closing, discussion that I have planned for us as a group. But before I move forward, I do want to, Adam Landeros brought up something that's actually, Adam, you're already thinking about a lot of the findings that we're seeing and in our interaction with people who are interested in this NCPC led data dashboard. So Adam Landeros, who's an incoming PhD student, I'm really excited that he chose us because he was a very wanted candidate at other PhD programs. So welcome to Merced, Adam. Thanks so much for this presentation. I was wondering if you have data sources in mind to visualize distance from tobacco retailers to clinics, hospital, community health centers and others, like that in a similar way?
Yeah, that's a good question. And that's a new question that I haven't been asked before. So the first thing we always ask is there a publicly available list of that type of layer that we're proposing? So, for example, all of our schools come from the Board of Education. They maintain private and public schools. There's also a list of pharmacies at the state level. So my question would be, do you know of a data source for those? And then what is the value for lots of users? I'm certain you might have a research question of interest in mind, but for lots of users, how would that benefit visualizing it on CTHAT? And if we can make that case, then it's something that we can do if the data are available.
Perfect. Well, thank you so much. I think there might be just one more question. I think there are a couple more questions from the audience. Dr. Norton is just wondering if you actually know of any others testing wastewater for nicotine in California. Are you aware of anything that's happening like that, Trent?
I don't. I read it at the beginning of a research article last week, and I thought it was a really cool idea, and I didn't know that was possible.
I know. Well, thankfully, the NCPC were actually funding Dr. Norton's wastewater research into nicotine content in the San Joaquin Valley. So we may well be the first, which is fantastic to know. So that's great. There's one or two other questions we have. I'm just wondering whether we just address those quickly. And so we have an anonymous attendee who's asking what would be considered a high density of tobacco retailers in the city, maybe anything over the statewide average of 0.7 to 1,000 people. Is that correct?
Oh, I don't know off the top of my head, but I'd be glad to get back to you all.
Okay, great.
We could actually probably put together some quartiles of what that looks like in the state of California, and then even split it by rural and urban areas.
Okay. Well, just to let you know, everyone, we'll close out the question session right now. I know that Dr. Durazo is going to just have a closing session, but thank you so much for all your questions. And just to let you know that there will be a follow-up. I'm actually recording this webinar, so I'll put this on the website as a source of information for the future. And we will endeavor to make sure that we answer any of the questions that we've not answered at the moment. And so by all means, if you do have any further questions, don't hesitate to let me know, and I can pass those questions on to Trent and Stephen, or to anyone else, the questions that you might have. Obviously you've received my emails already, so you should be able to easily find me, and I will address those questions as and when I receive them. So be on the lookout for the follow-up from this webinar, as well as the invitation to potential future smaller discussion groups in which we can really interrogate what will be really useful for this data dashboard. So at this point, just as we're kind of coming to kind of a close towards the 12:30 end of the meeting, I'll hand over to Dr. Durazo, who'll just take us through some closing comments. But thank you again for your attendance, and hand over to Arturo. I'm not sure.
Thank you so much, Alex. So yeah, let's move into just checking in about what the next steps look like. And before I get into it, Trent, thank you so much for being so generous with your time, sharing really helpful just information. And this helps us also. For one, it helps us really think about how we're mapping out that we're unique from other data hubs. And two, we've already, even with preparing for today, we've learned so much about things that we just did not think about, and we will get into it. And at the same time, our registrants did think about it. So I'm looking forward to sharing with you a lot of the things that you're already sharing with us that you filled out during the pre-registration. So our first step to putting this together about where we're going with generating a data hub actually started in 2022. The request for it actually came years prior, especially when you would see Alex Miller working with Professor Anna Song. However, in 2022, the American Heart Association, who was a collaborator with the NCPC at the time, led a focus groups, interviews to get more ideas about like where should the NCPC go after its initial funding that was going to end a couple of years ago. So first, let me okay, why is this not moving forward? There we go. Okay, so just to get a reference, when we talk about the San Joaquin Valley, we're actually also including some of the counties, and I see that a lot of people are here from our local Sierra Nevada foothills. So we're talking about 11 counties that also include the local Sierra Nevada foothills, and here are the states. And by the way, I will be sharing a link to all this information, so you will have this. So let's get into who registered. We were very excited to see that over 100 registered, and that's not including us. Actually, I didn't register, so this does not include me. And we had a really wonderful diversity in who you represent, what fields you're in. There's advocacy, policy, academia, some of the universities. And even within the academia, like we have undergraduate interns who are very excited about building their own skill set and envisioning themselves as like future tobacco, control leaders, public health, the local leading agencies, and healthcare. And also we had a lot of other people in leadership roles. It was clear that a lot of you are involved with either evaluation, grant writing, or demonstrating designing new programming around tobacco control. We had a very strong representation also across the board. So thank you, everybody. I'm not going to get into the details. As I said, these are all listed, but these are pretty much all the organizations that are represented. So it's really great to see such diverse representation, not only in roles, but also the organizations and affiliations that are present, or that are interested in learning more about where we're going with this dashboard. One of the other things that we checked in with you is getting an understanding of how long you've been in tobacco control. Similarly, I was really thrilled to see 1 out of 5 are actually people that have been, many of you are very new to tobacco control. So first off, welcome. We need fresh blood. We need new ideas. Take my job, please. We'll be hiring too. So please do. Yeah, I was really excited. And first I want to start by welcoming you and just, and however we can help out, please do let us know. If either with us directly at the NCPC, or we can connect you with any of the other local groups, public health departments that are leading tobacco control efforts. Also, we had a great representation for people who've been, our tobacco control veterans. And I also want to thank you for all you've done, because I myself have been in tobacco control, and this is not a humble brag, I'm just trying to count. But where I was going with this, those of you that are 10 years and more, I started in 2018. Those of you that have been doing this 10 years or more, thank you so much. You paved great way for individuals like myself and others who are behind you. So thank you for all your contributions. One of the key questions we asked, and this came from you, Evie, like, hey, you should be checking in with people. Where are they with understanding data dashboards and their knowledge? Thank you for that, Evie, because we didn't ask that, when we were working with Green Info last summer. So this is great. And this gives you a breakdown. 1 out of 4, a little bit, 1 out of 4 of you had not used a data dashboard in any context. And then there was a wide representation, and it was actually, we saw some expert, advanced, intermediate, and maybe 1 out of 3, have basic knowledge. So let's focus on our new users, people who have not used who have reported they have no familiarity with the data dashboard. So it is the one out of 4. And we asked you to envision what would you like, from a data dashboard that can help you with your tobacco related, work. And here and I've ordered them for you. These were we had a few, actually we had a couple of ties. That's why you see like 2, 2 and 4, 4, but it's actually 7. And the top one was community engagement, that you're looking for data that supports your community engagement. The next was a tie between grant writing and research. Then next, evaluation, and also health education and policy and advocacy and resource allocation. And even though they're rank ordered, 21 out of, a little bit over 30 is great. That's a really high number. So thank you so much for expressing how you would find such a data hub valuable to you and future work. And now let's check in with people who have used data dashboards in the past, especially around tobacco control work. So this is now our 3 out of 4 people. And one of the things we asked you and wanted to check in about is, how have you used these tobacco related data hubs in the past? And these are also rank ordered. So it went from evaluation to policy and advocacy, health education, grant writing, research, and in 6th place, resource allocation. And this is like a part where even for myself, I'm thinking, is this maybe I'll speak for myself because I'm the one who designed the questions. Perhaps I needed to think about more like in what for policy decision making, or is this to like prioritize what type of tobacco prevention control program can happen within a CBO or a local public health organization. The other thing that we asked you, what's made you pull your hair out in the past around data dashboards? I don't have any to pull out, so I'm jealous if you do. And your first one, which actually came up in this is one of the questions I had prepared, is lack of training and technical assistance. And that is something that we've been paying really close attention about how we're going to think about preparing for that and how would we roll out a training. So we definitely hear you on that. And that just goes across the board. And even like looking at all the wonderful exchange and interaction that just happened, a little bit over 30 minutes with Trent really speaks to that. And Trent, this is something you had also brought up, when we were preparing for this, that the customization maybe is not as user-friendly. Concerns about how current data is and how reliable it is. And also integrating, and even by those questions that come up, like the integration issue is something that stands out for a lot of people who have experience with data dashboards. The technical glitches, I think that's just everywhere. That's on everything we use on a device. So really good point. And one of the things that we are thrilled, which has already been mentioned, Green Info is a leading tech designer, which is amazing that you're a nonprofit. And you've already demonstrated across many directions how great you are, and I have a lot of confidence that you're going to help us have the least types of technical glitches. And then at the tied for bottom were privacy and security concerns and maybe outdated and inadequate hardware. Something that I synthesized that a lot of you wrote in. And this is, we're hearing you, we hear you, because this is something that we also as NCPC are with you, is how do we break it down for rural areas? Many times people that are in more remote areas or rural areas, their information around tobacco use or any other type of like retailing licensing is plugged into like a bigger city like Modesto or Fresno. So thank you for all of, so thank you for that. And the data needs that you are suggesting are the following. It went from community engagement, grant writing, research evaluation, health education, policy and advocacy, and resource allocation. And we're almost done. So I'll go send these. And these are things, and I'll also send out, I'll put the link right now as soon as I could close this. I'll put it in the chat, and also we could send it out to Alex when we're done. So here are things that you wrote in and said, these are the things that need to happen. And a lot of it, as you can see, is around the visualization of the data, more breakdown on demographic, and this will be more discussed. So moving forward, please be on the lookout for Alex reaching out. We will have smaller group discussions to discuss in more detail those findings from the Green Info Community Survey and I know many of you met Maria La Madrid, which Stephen has mentioned. So we're thinking that I know that a lot of you have a lot of big activities around grants. So I believe, Evie, did we say that probably after August or starting August would be a good idea to start those?
Yes, that's accurate.
Okay. All right. Thank you, Evie. And thank you, Evie, for all you've done to help us really, structure this and be where we're at. And so thank you. I know it is 12:30. We really appreciate your time. And okay, let me get out of here. So I could, so those of you who are still here, you can get the link to the slide deck now.
And just to let you know, thank you for attending. It's wonderful to see so many of you and such a variety of organizations represented. But I'll send out this slide deck after this meeting or in the follow-up emails that we have. The recording of this will be put on the website, and I'll send that to you once it is all available. So you can use this as a resource. And by all means, if you do have further questions, please do not hesitate to get in touch with me. And also kind of make sure to try and follow us on social media. Again, I'll put in links on emails for all of that kind of information in the next few days. So again, thank you all so much, and thank you to our amazing panelists, and especially to Trent and to Stephen. Thank you so much for joining us and sharing your wisdom, as well as your understanding of what will be really beneficial for our day-to-day dashboard. Certainly see that it's amazing, and we hope to have something at least is half as good as that. If not better, but we will hopefully develop our own branding with that. So again, thank you so much for all your time and your work into putting this webinar together. And thank you to Evie, of course, who is one of our leading partners in the development of this dashboard. So thank you all again, and we will be in touch soon. So thank you all very much. Goodbye.